Okay, this video, it is a video that I'm going to uh, explain as a student to explain how to perform tracheostomy care. Tracheostomy care to the patient. Okay, so number one, actually, just came from my whatever nursing unit or supply unit, and then he prepared and they know what I'm going to do. Then I'm going to the patient. Number one, I've already wash my hands before even entering my patient's room or touching anything. So then I will knock. That's number one. Now I will knock out to come to the patient. Before I visit my patient, I will actually use my sanitizer or wash my hands. Then I'll introduce myself. My name is Michael. I'm a student practical nurse, and then I'm here for tracheostomy care. So and then I'm going to ask my patient to identify my patient with at least two identifiers. Those two identifiers, maybe the badge. Of course, it's going to be the badge, and it's going to be the date of birth. And let the patient, if the patient can talk, let the patient tell you the date of birth. And sometimes it can be even their surroundings where they are. Okay, so what is your name? My name is Mr. Dwayne. Okay, so but since I'm doing it that, I'm going to have my order, my email or my order with me, because I have to make sure is the patient telling me the right name. So what's your name? My name is Dwayne. Okay, now okay. What is your birth date? My birth date is April 28th, 1956. Okay, so now I finish. I go back. Okay, and then I explain the procedure that I'm here today to perform tracheostomy care. Okay, then after that, I will make sure I'll provide I wash my hands, and then I'll provide the curtains. So I'll close the curtains to provide the privacy for my patient. Then I'll finish. And actually, this is when if you see this one, I'm pretending this is a tracheostomy that it is under my patient here. So it is here, and this is my patient. This is the head of my patient. So then number one, I will make sure I will raise the bed for my mechanical bodies. So my mechanical bodies, and then I will perform in order to position the patient, and then I will press the barrier protective to protect my patient's clothing from getting dirty or wet. Then because I'm going to use the fluids, I'm going to use some liquids, and then after that, I'll make sure my patient is set up, is in a position of semi-flower or semi-flowers position. Why that position? That position is 45 degrees, that is allowing the patient to breathe well. I am not going to let my patient to lie flat. That can cause respiratory stress. So I'll make sure my patient is up. Not even 90 degrees, because if 90 degrees can cause the patient to suffocate for someone. But I will make sure my patient is on 45 degrees angle, that we call it the semi-flowers or flowers position. Okay, now I raise up the bed, and then I present my patient with explaining to the patient, and then make sure in the oxygen. Or here, I'm explaining here, what you see here, this is my oxygen in the sac. Everything will be coming here when I'm sucking my patient's cleaning my patient's cough. Okay, so then all that I'm done, and then I'm going to wash myself. And then over there, I'll put my gloves on, wash my hands, and I'll put my gloves on. This is not sterile gloves. I'm putting my normal gloves on. Putting my gown on. This is a tracheostomy care. Sorry, that's a tracheostomy care. So I have to be with the gown. I have to be with the gloves. I have to be with a mask, and I have to be with the face shield. Those things are PPE, personal preventive protection equipment. So those have to be with them when you are performing tracheostomy care. Okay, so those. So now I'm pretending I'm putting gown. Okay, so now number one, I'm going to put the gown on, which is going to be number one, the gown. And number two, I'm going to put the mask. And number three, I'm going to put the face shield. And then in the last, I'm going to put the gloves. Gloves done always last. And then after that, I'm going to finish that one, and then I'm going to press the patient kit. There is two kits I'm going to use, but one I'm going to start with the patient kit. That patient kit, there is actually there is a normal saline inside, and there is normal saline. But why did I put these gloves? I put these gloves to position and comfort my patient, and to make sure the tracheostomy is on a good position, and then I can be able to touch even my sac where I'll be sucking everything going over there. So I have to use those because there is a fluid, and that is how I have PPE on. So even if I'm going to remove these gloves, but I'm going to keep my gown and my mask and my face shield on, but I'm going to be changing the gloves. There's a place twice where I'll be putting sterile gloves. And okay, so for that reason, and then after I finish my patient is already set up, and then now I'm going to do is I'm going to remove my gloves because I've already set up my patient. My patient is out. Then I remove my patient, my gloves, then I throw it according per facility policy. Then I wash my hands. Then I finish washing my hands. Then I'm going into my computer to make sure that what I'm doing is what I've been ordered by the doctor. So I finish my hands, and then this is my kit, my first kit. So what I'm going to do is I'm going to use this one to prepare my sterile area. So this is sterile. Here you can see is sterile. So I'm sterile this one here. So while I'm sterile this one here, what I'm going to do is I'm going to have gloves in my kit. Inside my kit, there is the first kit that is on the patient. There is a gloves, there is sterile gloves. This is in my kit. I put it over here. Then the gloves are covered inside of this one. You can see this one here. So pretending these are gloves, you can see, but inside they're sterile. So when they're sterile, then you open my gloves. Okay. When I open my gloves, from away, this way, come this way, go this way, and then it lasts to me. So when I'm doing it this way, okay, when I'm doing it this way, then I'm going, because I wash my hands, then I'm going to press what? My finger. I can start whichever I want, whether left or right. That's what they are. You see this way, I'm going this way. So I may start with this way. And then it's okay if I can touch at the beginning. And I'm going to protect that these gloves, they are in the middle. They are not at the edge of my surroundings. So I'm going to put over here. Touch here. I just touched it here, not at the middle. No, just here. It's okay because my skin here is in the contact. It's okay with that. And then my skin has been washed. So, but this is, I have this sterile gloves, and then I can touch in the middle or I can touch inside. Now I'm sterile. My gloves are sterile. Now I'll keep my stuff. But if I have anything, I can touch in the middle here. If I don't want it, then I throw it. I don't care. You see? Because that's when I need my area to stay sterile. So then at the end of the shift, at the end of the procedure, I can take out everything. So then I'm gonna keep these hands above my waist. So this I'm doing this one, I'm going to make sure my patient it is the suction pressure it is 120 millimeter of mercury. So that one is going to help the patient from suffocating. So from there, I'm going to what I'm going to do is I'm going with my hands up. I'm going to connect my kit. I don't know if I can be seen well. This is my kit. This is the suction, and then here, this is the saline. Then the saline is here. Okay, when saline is here, then what I'm going to do, I'm going to set tracheostomy. I'm going actually to remove the tube. That tube will be removed. That is the tube inside that will be removed. Then for that, then I'm going to the cannula. The cannula will be removed. Now I'm removing the cannula. Okay. I'm pressing the cannula in the saline and the hydrogen peroxide to be cleansed. So there is that kit, there is the water that I'm pressing over there, that cannula. So now I'm going to press my tubing. My patient is 45 degrees far out. Then I'm going to press inside, and then with the dominant end, the other one is pressing 10 to 15 seconds. So it's pressing until I feel resistant. I will press it until I feel resistant. Resistance, it might be patient's cough. So I'll put it to the patient, then I'll suck. Then when I'm removing out, I'm sucking 10 to 15 minutes. Then I'm removing. But this stuff, they are going over here. So when they are coming here, they are sucking from through this tube, they are coming here. So then in 15 seconds, then I'll put everything. Then I will do this catheter. I'll put it over here. I'll make sure. Okay. Then inside I have these gauze. These gauze will help me to clean my patient, but I'm not going to use hydrogen peroxide if the patient's stomach is red or it is irritated, because hydrogen peroxide is a tough. It can burn or it can irritate tissues. It can make burn tissues, or it can irritate tissues. So it's good to mix. I'm going to mix a half of normal saline that I'm using, and then a half of hydrogen peroxide and a half of normal saline together. Okay. So and remember now, my cannula, it is in the water. So what I'm doing, I'm done. This is my cannula. But when I'm done these things, I'm throwing them. I'm gonna throw them. This is my cannula. So since my cannula is in the water, I'm gonna clean my cannula inside. I remove them. My cannula is small. It's just like this. So then I'm gonna clean it. I'm gonna put in the water over here. I'm gonna clean it. I'm gonna put here, remove it, and then put into another, because the kit has a different. This is now the second kit over here. Now if I'm done cleaning those things, I'm going to remove my gloves. I'm going to wash my hands. Now I'm getting the sterile kit, another sterile kit. That's another sterile kit is here. So I'm getting my another sterile kit, and then I'm repositioning the client. I have to put like something like to protect my client on the chest here, like this. So in order to protect my patient, that's maybe a barrier to protect my patient. And this is remember, this is a tracheostomy. Okay, so now I'm doing it that one. I'm going to put to done my sterile gloves number 2. So these are sterile gloves. By the time I'm doing those things, I'm not touching these things. Everything is sterile. But this is home. I'm at my house, then I'm doing home. That I'll be in an environment that is allowing me to perform good care. So so this is my gloves. In the middle, remove as I said, avoid cross contamination. Don't jump to that one when you open the gloves. Then you come this way, then don't touch gloves in the middle. This way. Okay, that's this way. Okay, now gloves are on. And then I can use this one, like you see in the middle, and throw it on to create my good environment. So now, actually, if I make a mistake like now, and then I have another set of gloves, I can remove this glove and this one, and wash my hands. Why I'm removing this one? Because one hand is going to be with the gloves, okay? And then now pretend this one is the sterile gloves again. So now it's going, one hand will be with the one gloves. Then now let's continue. So this is sterile gloves. Done. So now, so this arm, one arm is going to remove the cannula. So when it's removing the cannula has to be removed according to the way it's sitting. If the cannula is 9 p.m. or 3 p.m., it have to be inserted this way. If it is this way, 6 or 12 p.m., it has to be going this way. So now I'm going to follow the way it is. Then I'll place the cannula in the normal saline again. So that one is the normal saline. I'll be pressing over there, and then now I'll put another gloves. That this gloves is sterile gloves. So now I'm sterile. Now I'm going to clean again to dry my with the gauze, to dry with my the cannula. Then the cannula. Press my cannula. So mine was facing 6 because this is 6 and 12. This way until it's locked. Then I'm gonna lock it. Then I'm gonna lock it. And then I finish locking it, and then I'll press the tracheostomy pipe that is from here. I put it over here. Then I'm gonna bring this one string will hold, will go on the patient's back, and then will hold my patient. And then I will remove the other one, and then I will clean everything that is there, making sure the area of my patient is dry, and then is moisture, not dry too hard, is moisture. Okay, not dry to cause an infection, and no pus or no fluid that is unwanted. This is just moisturing according to the order. Then I'll discuss everything, and then after that I'll take everything. Actually, this one is in place. I'll scan everything, and then I'll throw everything to the biohazard container or per facility policy. Then after that, my patient is good. I'm going to make sure he's okay. Then I'm washing my hands. I'm going to document those documents, appropriate information that is needed. And then I'm going to finish and make sure the correct is in place. My patient is comfortable, and then keep assessing my patient for comfortability, and then for all process that my patient is going through. And then I'll come back, and then I'll promise my patient, yeah, I'll come back, Mr. Dwayne, I'll come back to check on you before the end of my shift or after 30 minutes. And then after I finish, safety, opening my curtain, washing my hands, documented you already. Everything is good. My room is clean. Good.